Often in public health, we see a conflict between science and politics. So if we look at science, we get some pretty clear answers on things. It's a really good idea, especially for people who live in a desert, to wear sunscreen every day. It's going to dramatically reduce our risk of skin cancer. But at the same time, we don't probably, although you don't have to raise your hand because it's an online class, probably the majority of you are not wearing it right now, even though you probably live in the desert and are at greater risk for skin cancer. So just telling people what to do or knowing the answers to things does not automatically lead to behavior change. And often the reasons why people aren't changing comes down to politics. And I'm not really talking about Democrats or Republicans here. I'm talking about small p politics, which is how groups make decisions. And you participate in this. Maybe if you go out for an evening with your friends and you decide to drink alcoholic beverages, right? You didn't decide to go for a walk, or maybe you did. Maybe you went to go play a game of pickup basketball down at the wellness center. So there are some times when group decision making leads to good outcomes, but often we find that what the science tells us is the best thing to do for our health, and what group decision making tells us are different. And then we also end up with conflicts between individual rights versus the right of society. For instance, smoking is a great example of this. Before we started with our tobacco control legislation, people could smoke wherever they wanted. As a professor, if I wanted to smoke in our classroom, if I wanted to smoke in my office, that was my individual right. And the rights of the people around me to breathe clean air were not yet as important. We have seen some shift in that, of course. Now we've seen that the rights of society to have access to clean air, indoor and even outdoor in some places, more important than an individual's right to smoke wherever they want. So just because we take a stand on something being an individual right doesn't mean that will stay the same over time. But we'll continue to talk about that over the course of the semester as we talk about important health problems and the solutions that science has provided. When we talk about public health, we have 6 important disciplines that make up the field. And we'll talk a little bit about these. Epidemiology is where we'll start because that's the one that we're going to dig into first here in the course of our public health introduction to public health class. So epidemiology, this is the one discipline that's truly unique to public health. This is our basic science. And it basically answers the question, who gets sick and why? So it's like disease detective work. If we have a sudden outbreak of foodborne illness here on campus, we're going to start to dig in and see if we can figure out what those people all had in common. Did they all go to the same off-campus restaurant? Did they all eat at the same in-campus facility? Did they shop at a grocery store near campus, right? Or if they're not on-campus residents, what might be another reason why all of these people in the same environment are beginning to get sick? And we'll talk more over the next couple of classes about how epidemiology works and what we can find out. But this is the one discipline that's truly unique just to our field. We're also going to be spending a little bit of time this semester on statistics, focusing in on the subfield of biostatistics. In any time that we use statistics, we're basically talking about a way to interpret data in order to increase our knowledge of a situation. We'll do some examples of some biostatistics here in class. Just so you know, if you're not a math person, I never expect you to conduct or to complete a math problem on a test. I'll just expect you to understand the principles behind the kinds of tests that we do. Another really important part of the field is the biomedical sciences. And this is where we get the basic science that helps us to understand what the causes of diseases are, whether they're infectious diseases like HIV or AIDS, or chronic diseases like heart disease or cancer. At the heart of it, we need to have the biomedical science in order so we can understand what the risk factors for the diseases are and how we can approach prevention and eventually the cure for these kinds of conditions. We've also got environmental health sciences as an important part of the field. This is clean air, clean water. In many places in the United States, we do take clean water for granted, right? You may decide to drink filtered water instead of tap water here in Las Vegas, but you probably don't worry about getting an infectious disease when you turn on the tap and get yourself a glass of water or maybe drink from a water fountain here on campus. Of course, that's not true. That is in all parts of the world. There's almost 2 billion people in the world today who are unable to make that same assumption. So this assumption is definitely a first world privilege that our water is not going to make us sick. But it's not just air and water. This also includes things like food safety, and monitoring of prescription drugs to make sure that the safety of those products continues to protect our health. Lots of ways that we can include the environment around us and its ability to either protect or put our health at risk. We've also got the social and behavioral sciences. This is actually my part of the field, and it's something that's become increasingly important over the past couple of decades as we see fewer and fewer people die from infectious diseases and more people suffering from chronic disease. Infectious diseases, things like influenza, diarrheal diseases, they don't kill as many of us as they used to. More and more, we're going to die from something like heart disease or type 2 diabetes. And social and behavioral sciences helps to impact the way that people behave, how the way that we work or play or eat can end up affecting the health conditions we may experience. This helps us to address the major public health epidemics that we're talking about here in the 21st century, things like heart disease, stroke, and cancer. And again, over time, as infectious disease has become less important, this branch of the field has become more important. And then later in the semester, we'll also talk a little bit about health policy and management. And this is where medical care and public health start to overlap again. We've got a lot to cover, but we'll cover this later in the semester. So just for now, keep in mind that this is an important part of the field as well. All right, so our last new concept for today is the levels of prevention. Anything that we do in public health, it's going to fit into one of our 6 disciplines. It's going to fit into one of our 4 core functions, and it's also going to fit into our levels of prevention. These are primary, secondary, and tertiary. So with primary prevention, here we're aiming to prevent an illness or injury from ever occurring. A great example of this is vaccination. When you get a vaccine for something like chickenpox, you don't get that because you're about to get sick. You get that to keep you from ever becoming ill in the first place. That's an example of primary prevention. Another hallmark of primary prevention is that it's applied to healthy populations, right? We don't wait for people to become sick and then start to make change. It's something that happens while you're healthy and is meant to keep you in that condition. Next, we've got secondary prevention. So secondary prevention, the goal here is to minimize the severity of an illness you may already have. Screenings are always an excellent example of this. So let's say you go to a health fair and you get your blood pressure taken. It's a blood pressure screening, and the goal really isn't to prevent you from having high blood pressure in the first place, right? It's to find out whether you have it and get you into treatment while your blood pressure hopefully is still mildly high and easier to control. So that's an example of secondary prevention. And then finally, tertiary prevention. This occurs after the disease is in full swing, and the goal here is to minimize the disability that may occur. A great example of tertiary prevention is access to a high-quality EMT network, right? So if you're in some kind of a car crash, we can get an ambulance to you quickly, and we can get you into an emergency room somewhere and get you some kind of trauma care. Or perhaps after a heart attack or a stroke occurs, having the ability to go to a rehabilitation facility that would help get your health back on track and minimize any consequences of that condition. So these are our levels of prevention. Primary applies to healthy populations. The goal, keep that illness or injury from ever occurring. Secondary prevention, catch it early, minimize the severity, the cost, both in terms of healthcare dollars and quality of life. And then tertiary prevention, after the injury or illness occurs, trying to minimize any disability that may follow. So those are levels of prevention. All right, so that wraps up our first virtual lecture here. What we did today, we talked about our definition of public health. And frankly, we'll continue to refine this over the course of the semester. As I mentioned, it's a broad and complex field. We talked about our 4 core functions, and then some differences between public health and the medical model after we used that medical model as an analogy as we talked through our 4 core functions. We talked about the role of politics. Again, not really Republicans versus Democrats here, but more group decision-making, group influences on choices. And then our 6 public health disciplines, which we'll spend more time on as we move through our semester. And then finally, our levels of prevention.